And we are live, but neither one of us are taking down the little sign.
What a guy!
Welcome
I tell you,
to
we had
Soaring
one. You had
Pilots
one job,
30.
pal. You had one job. We're trying. We got a professional. We've got Dr. Miriam Zylberglait. How do I do?
Try again.
One more time. Zylberglait.
Nope. Is it? Oh.
Why are you all over me? We are going to go with Dr. Z. Miriam, Dr. Zylberglait, Dr. Z, thank you so much for joining us tonight. Other than this brief little technical ability that we had there at the very beginning, look at us rolling here now. Dr. Z, a virtual well-being MD, medical doctor, a mother, wife, physician, educator. This is the one that I'm really excited about tonight because I think we're going to have some really...
Don't forget author.
Oh, hey, I'm not even done yet. Why are you cutting? Who brought you? Who brought this guy?
I come with the show.
Yeah.
That kind of
author, the most important part here, which I like too. The 3G cycle of life. I think we're going to have lots of dives into this and the secrets for achieving joy, meaning, and well-being. First of all, Dr. Z, thank you so much for joining us tonight.
Thank you so much for having me. I'm so happy to be here. You guys are amazing.
Perfect. Doctor, after all of that, we had a brief little encounter in the back in the green room, if you will, about how you ended up here. And I think it's a beautiful, and I want to lead off with that. So first of all, you fell in love and ended up being an American. How does that happen?
Oh my gosh, yes. I always promised myself that I will never leave my country because I was very happy with my job and I was very happy where I was. And so I didn't expect this to happen. I came to visit my sister that was living in Miami. At that point, I was living in Peru. I met my husband. We dated back and forth Lima, Miami for a year. I came supposedly for vacations and I never went back. He proposed and we got married. So I came to the US because of love.
I love that. And such a cool story. And obviously, so how long have you been in the United States now?
12 years.
12 years. So it doesn't look like you're going home anytime soon?
Oh, well, I'm actually going to visit my parents. My parents are still in Peru. I will be there in a couple of weeks. So yes, I go back to, to hug my parents. I need that energy.
Absolutely. So now a little bit about you. Obviously, you're a physician. That's your, by trade, Dr. Z. And were you a physician trained in Peru or were you trained here, or what's your background that way?
So I trained in Peru and I work as a physician for the Navy for 10 years.
Wow.
Yes, I love it. And I was also working on doing research and in academia, teaching residents and medical students. And when I came here, I came really to start from zero. I was not able to practice. I had to go back and train again. And I had, at that point, faculty and bosses, if you want to call it like that were almost like my kids, really. Very young. So it was an interesting experience and a very humbling experience also, right? Because you have to forget that you were in a certain position and you need to go and really, with a smile on your face, follow the rules and follow, your new life.
Right. So now so obviously we're based out of Canada, and we hear stories all the time of physicians that come from of other countries all over the world and come to Canada and struggle getting their accreditations recognized here and being able to practice. Now, obviously, you went through that process. Did you find that the United States was helpful in that? Are they looking for physicians to come in, or was that where they're like, we don't care what you did, you have to redo absolutely everything and good luck?
Yes. So in my case, like in any case, your training as a physician counts. So you are considered a physician, but in the US, you cannot practice as a physician if you don't do the residency, which
Right.
is the specialty. So even you are considered a physician, you cannot practice without going through the residency. And for that, you need to fulfill all the requirements that any American student had to fulfill. And this means what we call the step 1, 2, and 3, which are tests that each of them last an average of 8 to 9 hours.
Okay. Just a
But
light reading.
yes, but very simple. Actually, step 2 is 2 days of test. So I was very lucky that my husband supported me, and I was truly sitting down from 12 hours per day, only studying, and a year later, I had almost all the tests passed, and I was able to apply to residency and etc. But truly, I was very, very fortunate to have that support. Many immigrants come and they don't have a personal support, and what they need to do is to work in whatever it is, right? Even driving Ubers or whatever.
Right.
Yeah.
And at the same time study, and that gets things very complicated. To be
How did it, like, so in Canada, like Pat said, it's almost impossible to use your accreditations from another country.
Yes.
And so I've talked to Uber drivers where they're like, I was a doctor in Dubai or wherever it is. And so those people that I talk to are like, yeah, no, it was just crushing. Like, I can't just start all over. So how do you, Dr. Z, come to America? And you're told you come for love, and life is great because you have those rose-colored glasses on, but then you find out, you know what, I can't do what I love to do. How do you make that transition from being deflated? Because I imagine there was a moment that you were deflated, that you were like, I cannot believe that I have all this knowledge. Like, I could teach it to the people that I got to stand beside and walk with them, and some doctor who's like, probably hasn't been in it as long as I have gets to tell me what to do. Like, how frustrating, and how do you get through that?
Let me tell you, first of all, it was very difficult. It was absolutely difficult. I remember that the first book that I chose was the one for biochemistry. And you need to understand that I went to medical school in 1998, right? Whatever. So a lot of genetic tests, the MRI didn't exist, the CT. So all this basic science that now are obvious and part of medical school, they were not even created when I went to medical school. So even I know how to read an MRI, I have no idea the science behind it, right? I cannot take a test about that, or I couldn't when I came. Right. So suddenly I'm studying things, not only that I don't remember, they didn't exist on my time. And I remember start crying in front of the biochemistry book and the computer, but for hours. Like my husband will leave the house, he will come back, and I will continue crying. And at some point, the story probably is not exact anymore, right? 12 years later, I don't know how my memory is creating this, but he kind of told me, it's like, you have 3 options, right? Or you decide not to be a doctor and do whatever you want. You can be a mom, you can, do whatever. At the end, you have to start from zero anyway. So do whatever you want. You go back to Peru, we divorce, you go back to Peru and you are a doctor there and forget about the steps, right? Or you shut up and you start
See, I like this. What's your husband's name, Dr. Z?
Oh, that's awesome.
What is your husband's name?
Alex.
I like this Alex fella. So again, before we started today, you shared a few little things. This man is pragmatic. I don't know if he's out there watching right now or not, but he gets Dr. Z on a plane, flies her over to Las Vegas. And how did this all go down? How did you get proposed to, young lady?
It was romantic. There were balloons and planes riding in the sky.
It's like, Las Vegas is the place where people get married, and maybe we should get married.
I like this guy. He's
And it works.
pragmatic. Are you going to sit in front of the computer and cry, honey? You get out if you are. Let's go. I like this.
Shut
Alex
up.
Cat.
I needed that. Let me tell you something. I mean, it's not that I smiled at that moment. Probably I had a tantrum, right? I don't remember.
Right.
But I needed that because I was in a place where I was a victim of everything that was happening. Imagine, I studied so much and now I have to do this, blah, blah. And yes, you can live feeling like that, or you can take, a better decision. And that kind of a virtual slap in my face of reality helped me. And after that, I don't remember complaining too much about the studying. Actually, I started to focus very well, and my exams were amazing. I was impressed, like, oh my goodness. But again, I feel like I need to be grateful because I was, in a protected environment where I was able to focus and I had the support that I needed. And I want to recognize that because I see and I know many immigrant doctors that really struggle through this process. It's truly difficult. It's really complex.
Right.
No, you touched on a couple of things there. One, having a base, having a group around you. Like we talk about mental health all the time on Soaring Profits. And a key factor is not being isolated. If you have a group around you, someone who can walk in and go, shut up, don't be a victim. Like it's very important.
Everyone needs an Alex.
Don't get me wrong. Super important to feel those feelings. It's super important for you to have gone through that and went, you know what, this sucks. This is the worst. But then you need someone. Like for me, it's Pat a couple of times throughout my life. And I've had some tough moments in my life. He's walked in, he's like, yeah, man, your life sucks. Get up, start doing stuff. And that's just it. You need that like catalyst. And when you have a group around you like you do, it's amazing. So you got you became a doctor, even though you were already a doctor, a really good doctor in America. Then what? Like, so you land, you get married, you become a doctor. What's next for Dr. Z?
Well, I became a doctor while I became pregnant. So I did the training.
That Alex!
With a big belly twice. So I had Ellie and Ari. Again, my husband helping me, right? Because I was 30 hours on call in the hospital and my little ones were at home. I will be like pumping my milk in the bathroom of the hospital, or sometimes driving and put it on an ice and then leave it to Alex so he can help me to give my milk to the kids so I can go back to work. And that's how, the first years of my life in this country were very interesting.
Welcome to America.
Wow. But at the same time, I enjoy it. And I know that may sound crazy, but I truly had a blast. I really enjoy it. I believe that I had the blessing of being able to do residency or fellowship again, this time knowing medicine and just learning the system. I was very comfortable with patients. I knew what to do. I understood medicine, but I didn't, and still today, sadly, I don't understand the American system. I don't understand the politics behind, right? Or I understand and I don't like them, one or the other. But And sadly, in order to be able to practice medicine and I'm sure law and many other things, you need to know the rules. And that's what I learned during the process of training. And I am grateful that I did that, because if not, I will not be able to practice, even knowing a lot of medicine. That will not be enough.
Right. Yeah. So
we have a question.
Coming from
wait.
Oh, sorry.
We have a question. I think it's a good one. And so Raquel wants to know, can you talk about the journey Latino woman face in order to become a doctor? I think that's a really important question.
Another Latina, a wonderful Latina. So I probably had a better experience than many others because I apply in hospitals in South Miami, And here being Latino is kind of being the majority, right? So even I may be a minority in the country, I am
Right.
the majority where I am. So I didn't notice so much the discrimination, if that is the case, or any challenges even with the Spanish, right? It was actually an extra. You speak Spanish, great, because majority of the patients speak Spanish. However, saying that, not only being Latina, but being a woman in medicine is in reality a challenge. If you will see the studies, you will notice that majority of us, we don't achieve certain positions that any other gentleman will do, even if we have the same education or more. Our salaries are around 25% below, and sometimes even more than the ones for gentlemen at the same range of education or even less, in academia and in clinical practice. So even we work very hard trying to be successful, to be mothers and wives and Latinas and immigrants and adapt and etc. Sadly, we are still discriminated as women in medicine, and of course, being Latina in certain areas of this country is an extra reason to be discriminated or have less opportunities. Sadly.
Interesting. Yeah, I suppose, like you were saying, that going into South Florida, into Miami, you do have a bit of a language and cultural difference there. Heading into somewhere in Ohio, that would be like walking into a different planet. Like the language barriers, the societal structures, like kind of what Raquel was saying there, that would be very different. Yeah. Wow.
It's different. It's absolutely different. I mean, I never noticed truly. I didn't know that I was a minority, maybe others were able to see me as a minority. Still today, I don't like that term. I refuse to use it for me or for others, because it's derogative, right? It makes you less. And I don't think that I am less, and I don't think that anyone that, belongs to a specific group should be considered less. We are different. We come with a different background, but we have a lot of things to offer.
Absolutely. And a lot of those differences, like you're saying there, Doctor, and sorry, I didn't mean to interrupt you, but
sure.
a lot of those differences that you're saying, and especially the cultural things, I think are what kind of makes America what it is, right? So, when you come to America, you're bringing your Peruvian family background and your moral structures and the compass that come along with that. And now you come into a community in Miami, and now you flavor that community, right? Where here, like I look at our healthcare system in Canada, and it's very, very waspy, very, what would you say, like homogeneous, like it's just very much cookie cutter people. and I think that's, it doesn't really help in giving the flavor of that caregiver family environment where it's very cold, very sterile. And I think our healthcare suffers because of that. And that bringing that family, bringing that personal experiences from all over the world, I think is super important.
Yes, and something extra is that if you consider the amount of Latinos that live in the U.S., we are around 18% right now, and for sure the Latino doctors, we don't get close to that number.
Right.
And many studies have shown that patients have better outcomes if they are treated by a doctor that has the same cultural background. So that happens for, Latinos or people that come from India or whatever it is, right? So that communication that you have because of the culture that you have in common helps tremendously. And that's the reason that, especially here in this country, we need to educate more Latinos. And it's not only to speak Spanish, that's very interesting. It's not a language barrier. You can have an American doctor speaking very nice Spanish, and that is still will not compensate for the lack of communication, because the lack of common culture.
Well,
Um,
I think that's
Right.
a beautiful thing that you bring up there, and something that was really unique. We just came back from kind of a Hounds weekend down in San Antonio and did a bunch of work with folks down there. And again, just being among these people of all sorts of different cultures, it came out in the food. It came out in the way that, you know, we discussed and talked about cultural topics and just the things that we discussed. And, you know, if you're talking with somebody that has, you know, a generic issue, diabetes, and you understand that, you know, probably a salad diet or a very, you know, high fibrous diet, culturally, when they're sitting around with their families at night, that's maybe not traditional meal for them. So
Yeah.
you're trying to put them on Mars, you're trying to get them to jump off into a totally different realm than what they're used to. And sure, it's maybe what would help in the situation, but you're not diving into what they truly need and the box that they can live in and understanding their holistic care. I think that's kind of what it comes down to, right?
I love it. I love what you said, because that's the art of medicine, right?
Right.
And that's what I love so much about medicine, that even you may have protocols and you may have situations kind of by the book, right? But nothing is by the book, because we are
Right.
treating humans, and humans come with emotions and with cultural backgrounds and with histories and so many things that make an individual to be an individual. So
Love
the
it.
same pill may not, or the same protocol may not fit you, because whatever it is, right? Because your culture, because you are depressed, because you
Yeah.
just don't like that.
Yeah.
And we as physicians, we need to adapt, right? And be kind of chameleons, change our colors in order to be able to really not only uh, please the patients, right? That is one part, but to really help them to achieve their well-being in the way that connects to who they are, right? Respecting who they are.
So we were talking to a doctor in Brazil, and she was amazing. And she kind of took a whole person approach. And I don't know if that's different. Like in Canada, it's you have a sore back, here's some drugs, or, you know, we'll x-ray it, whatever. But she was like, I look at diet, I look at what you eat, I look at what your day looks like, I look at everything together. And like it just makes sense to me. Like, so I deal in behavior a lot. And a behavior can be triggered by so many options, just like a bad back can be the fact that I'm eating the wrong foods, or that I'm lifting things the wrong way, or it could be that I'm stressed about something, I'm sad about something. It could be a multitude of things. So when you do your practice, is it a very is it from is it a cultural thing to treat the whole person? And have you noticed that in America it is not that way? I don't know.
So thank you so much for the question, because it's very important for me. It's very close to my heart what you are saying. I believe that, especially in the U.S., because of the way that people has been super specialized, suddenly you treat, you know, the one finger, and that's it, right? And you are expert in one finger and nothing more, and you don't care about anything else. When I trained in Peru and when I came to the US and I trained again as an internist, I felt very disappointed, because in Peru, I used to see this holistic approach as part of my training as a geriatrician. And I will even round my patients with a social worker and a psychologist and a therapist and the nutritionist and the pharmacist. And sometimes we will have even a priest. And that was normal. That was our rounds. So I came to this country, and suddenly it's not only that you don't have the team, it's that you only care about the body. And now you are practicing and you have 15 minutes to see patients. And I am asking myself, when do I undress them? How do I dress them again? And what you can do if you are typing, right? And clicking all the buttons so you satisfy metrics that give money to the manager, because that money not even will come to me. And I was super frustrated. However, when I did the fellowship on geriatrics, and then I get my second specialty in obesity medicine, what I notice is that certain specialties or subspecialties, they still believe in this approach that is, multidisciplinary, holistic, if you want to call it like that, right? Where you see a human as a human, and the emotional, social aspect are important. And you were saying very well, right? If I am depressed, how I will go to the gym or do a diet and lose weight if I cannot even wake up from my bed and I'm not taking a shower for a month, right?
Yep.
Or if I am having social problems, financial problems, I lost my job, how do I buy organic food and I get a personal trainer to exercise with me? So that brings you back to, you need to treat the individual that is in front of you with all all the reality that surrounds that person. If not, I repeat myself this, and I repeat this to my students and my residents, right? A good doctor is not the doctor that is able to do a great diagnosis and prescribe the most fancy medication, right? I mean, majority of us, we will do that. That's what we get, in the test. That's what, that's the way that we graduate. You learn the diagnosis, you learn the pill, and the dosage. But a good doctor is the one that can see that patient, select the best treatment for that patient, and then actually have good outcomes. Because if you prescribe the best medication, but the patient will not take it or didn't understand what you order, or doesn't have the money to buy what you ask for, and comes 2 weeks later sicker, or if you're lucky the same than before, you're not a good doctor. You maybe have very good memory, you memorize all the information, but you are not practicing medicine. You are not practicing the art of medicine. And that's what makes the big difference.
It's totally true. Like, so I had this
think that
argument with a
healthcare-
specialist. Sorry, Pat, you're a little behind me, I think. I had this. So at one time I had Crohn's. I had really bad Crohn's. It was terrible. And I did some research, and I personally thought it was food. My doctor did not, wanted to keep me on meds. And I'm like, no, it's food. So I did a food change. I lost 152 pounds. I don't even remember. And then Crohn's went away. Like, I don't have it anymore. Wow. So then she and I had an argument. And my frustrating part was, why won't you listen to me? Like, I'm telling you how I feel. I'm telling you the results I had. I'm telling you, I get that your medical journals say that what I'm doing is impossible. But it is possible, and I did it. And so she's like, well, it's not possible. So we're going to do the test, the camera up the place where you don't want it. So we did it. And afterwards, she was like, oh, yeah, you're fine. So we won't have to do meds anymore. And yeah, I'll see you in a year. And that was it. I was like, not even like, isn't this cool? Like, I went from like hardcore meds to no meds, and I'm not recommending. I'm not a doctor. I know nothing, so please don't listen to me. I know nothing. But in my case, it worked, and I don't know why she wouldn't look into it or like at least examine it or anything. So I see her once a year.
I truly believe, as everything or anything in life, you have the average and then you have the extremes, right? Mm-hmm. And there's a big group of people that are not average. I will say a lot. And being flexible and being open-minded is part of being a good physician, right? And we need to respect our patients, and we need to pay attention to what they say. There are many cases, and I remember that from medical school when I was like super young, right? Like, those cases that the patient comes all the time with the same symptoms, and everybody says it's anxiety. One day it was not anxiety, it was a cardiac infarct, but nobody got it because all the time was anxiety, but not always will be anxiety, right? And it's not labeling people, no closing the doors for other things. At the end, medicine has been progressing. We know much better than before. But that makes us think that there are many things that we still don't know, right? And what was correct before, how many things that I used to do before, I will never do today because I will get sued for sure, right? It's like we don't do that anymore, right? We were forcing people to take aspirins, right? We are like, now, please don't take the aspirin anymore. Only these people need to take it. So how many things are changing in medicine because we are discovering new treatments, new information. So if we don't adapt and if we are not open-minded, we are missing the opportunity not only to learn, but to help others. And that has to be with our ego. We need to put our ego in a box, right? And be good humans, because that's part of being a good doctor.
You're muted, I think, Pat. Sorry.
There we go. Sorry about that, guys. My that died on me. So, well, it certainly sounds like you've done exactly that. Like when you look over your LinkedIn profile, you have an incredible birth of experience. So you come to this country, you fall in love, you have a couple kids, you have a beautiful, beautiful Alex. We've learned all about him. But then you've kind of pivoted and you're an author. Why did you decide that you needed to become an author? And what are you writing about in your work?
So I said once, and I believe that this is the best explanation, I had a very bad tantrum, and that ended being a book. I was very upset with the healthcare system. I was very upset with my job and the things that were happening around me. I was very frustrated, and I tried so hard to make things, better and different. And I just read what Raquel said.
I'm telling you, he's going to be a celebrity. We want to get that boy on LinkedIn.
Yeah, we're going to get him on LinkedIn. He'll be like one of the hounds right away, honorary member. Yeah, sorry.
It's okay. I interrupt myself. And I didn't know what else to do than to start writing. And I started with articles and suddenly podcasts. And one day the opportunity of writing a book came in front of me. And I said, okay, I will put in that book all my fury and I will say how bad the healthcare system is. Funny enough, the book experience was psychotherapy, free psychotherapy. And I met more than 30 amazing individuals in the process. And the book changed from being a tantrum and a complaint about the system and a fight with the world into a book that has just one chapter about burnout and 29 extra chapters about positive things and how to achieve well-being and how to achieve joy in life. It had a happy ending, but the reality is that being upset created my book. And sometimes we have to learn how to use, even negative experiences or negative emotions and make with lemons lemonade, and if it's possible, a delicious lemon pie, right? So that's my book, a lemon pie.
Well, that's amazing. I'm sorry, I'm just gonna cut off. We're about a little bit into 30 minutes, and I just like to, speaking of all these great people that we were talking about in the background here, the hounds, and all the wonderful people we met in San Antonio, I just like to throw out our little thank you that we like to do. Soaring Profits would like to say some thank yous to some great people. Sia from Brilliant Beam Media, a company to aid you with your existing podcast or to help you create something brand new. Mike Asherbrainer, leader of the Hounds of Business, bringing together people and teaching them how to use LinkedIn to grow their businesses. Lisa Browning, publisher, writer, storyteller of other people's shared stories. If you're looking to tell your story, scan the code. Michelle from Be Daring, working to spread mental health awareness and end the stigma. Walking Tall, an organization all about us gathering together and not being afraid to share our stories and to continue to walk tall. Tracy Lamb from Caregiving Worldwide Network, a wonderful network promoting and assisting family caregivers taking care of their loved ones inside their homes. Mike from Purple Tongue Hot Sauce. If you have wings, he has a sauce for that. Scan this code and say that Soaring Profit sent you. Janice, creator of the Tausi, teaching us all what real comfort is. Scan that code and buy a pillow. Say Soaring Profit sent you.
Look at that. There was even, I don't know if you noticed that. There were some Tausi folks there that might have been the Soaring Profits guys. I don't know. We'll work on the contract there.
Yep.
But that we talked about how your book was kind of this.
May I interrupt you? I just want to say that I love each of them. Everybody that was, it's like one is better than the other. It's like family for me. Amazing people, amazing professionals, and great friends. So yes.
I think that's why it was a perfect segue. You know, you were talking about, you know, the tempered tantrum that turned into a book with all of this spontaneity and passion that you brought from other people. And James, you segued it perfectly. And that's exactly what those guys are. And so you've wrote these books. You're building. What's now? What's the next stages for you?
Oh, so amazing things happening. So regarding the book, I just received today the complete and final version of my book in Spanish. So as a Latina, I am very proud to have now my book in Spanish, soon to be in Amazon. So be ready for that one. But something that makes me feel even more excited is I am writing the version for kids, almost done. And I'm writing it with my kids, and I am sharing the experience with some friends and their kids that are reviewing the book with us and that are giving advice and comments. And it's exactly the same component of learning how to use life and adversity as opportunities to grow and to, you know, to achieve well-being and amazing things in life, but in the version of kids, looking for magical crystals that will give them these superpowers. So hopefully also in a couple of weeks we'll be out. That's what keeps me happy and alive. And the other thing is my clinic. I escaped the healthcare system, the typical healthcare system, because if you cannot change it, you create your own. And that's what I decided. And I'm building my clinic, an opportunity to help people in the way that I want, and giving them the 60 minutes, 90 minutes time that they deserve, and feeling proud of myself and that the doctor that I am, right? And makes me feel so happy.
So Dr. Z, this is the big piece that I really want to touch base with you on around this, because I think it's a beautiful thing what you're doing with your clinic. So this is a virtual clinic that is online and accessible to individuals all over the world. Really, if you have an internet connection, you can be dealing with Dr. Z.
In the United States, I am restricted to Florida because of the laws of the United States, and soon in Texas because the license is coming. But yeah, it's a virtual clinic. It's a multidisciplinary clinic. I am very lucky to be collaborating with a health coach, a nutritionist, and a wonderful lady that is actually ex-Buddhist nun and a book author that is helping me with all the mindfulness. So my patients, they don't need so much medication. Sometimes just working with your body, with your mood, with your mind in general can help you to avoid so many, side effects that come with medication. So we are working, the three of us together, using not only the traditional medicine that everybody knows, but we are also using modern medicine. I call it like that, DNA testing to understand how your body works, your metabolism, and to kind of target what you need. So you are individual, right? You are different, and we treat your uniqueness. We are working also with remote monitoring, so We can follow your weight, your fat percentage. We can follow your vitals, even for how long you sleep, how many calories you burn per day, if we are working with your weight. And we are doing precision medicine, which means that if we will prescribe you vitamins or supplements or probiotics, they will be done based on a test that we are doing, and they will prepare specifically for you. So it will not be that you are getting in your body whatever is in the pharmacy, but this will be just for you, make for you. So very, very unique and very individualized. I believe that that's exactly what we need. We cannot treat everybody, like average. Again, we need to treat each individual in base of their uniqueness.
Right. So Dr. Z, you start this clinic. You've been working with other individuals and building this out and putting a fantastic product together. Like, looking through that, you can tell, like you were saying, the multidisciplinary factor there, the holistic view. Who are your clients right now? Who is picking up the phone? Who is calling you? Who is going online with you? What does that look like I'm going to take it from kind of a business perspective, but what does that look like?
So many times I say that they look very similar to me, right? They are high achievers, professionals, working hard, trying to be excellent in what they are doing in their work, but at the same time to have the energy to be great parents or amazing, partners or friends or daughters, and that have been compromising their well-being, meaning that they are probably not sleeping well or not eating well, that they are overweight, they have fatigue, they are burnout, right? And they need to compensate for all these years of effort and give their bodies all the energies and all the health that they need so they can continue being successful. I see a lot of people paying a lot of money for coaches, executive coaches, right? Or someone that will help you to create your magnificent business. But if you are not sleeping, if you are not able to concentrate, if you are depressed, if you are obese and fatigued, right? If you have a medical condition in general, for how long you can keep up, right? Trying to be successful and get the 7-figure paycheck at the end of the year, if your body is not allowing you. If you don't stop, it will be your body. If you don't create an environment, a healthy environment for you to be successful, your body will stop you. So I feel like we need to start changing a little the paradigm, right? We will not find success outside of us. We will find success inside of us. If we are healthy, if we are happy, if we are clear with our goals, with our boundaries, with our needs, our priorities and values, then we will be able to be successful. And that's what I am trying to do, to focus on those individuals and give them the aspect of mental and physical health so they can complement the extra with any coach or any other mentor that they are working with to achieve.
Well, Doctor, you took the words right out of my mouth, and kind of figuring out who it is that's going to you as patients. You're talking about the CEO, the top, achiever and that sort of thing. But even more so than that is that caregiver at home that has put that aside, that person that is, put everyone else before them and is now in a situation where they're like, I'm not well, I'm not where I need to be. And if I don't do something about this quickly, I'm going to have a problem. And it sounds like you're building something that's able to help these individuals on not only the physical basis, but a holistic, the psychological, the just an overall general view. So when you have somebody that comes into your clinic virtually, what are kind of some generic things that you're running through to ask them, as obviously why you're there, but what are some of the first things you're taking someone through?
Before I answer this, I'm glad that you mentioned what you mentioned. This is not only for CEOs, right? And success doesn't mean that you are in an office and that you are driving a Mercedes. Yeah. You can be a successful mother. You can be a successful teacher. Success is success is pushing yourself to the point where you are happy and feel fulfillment, right? And success has different colors and different flavors. So, so it's more the personality than the bank account in this case is.
Sure.
I love that. Like, so for a little while, my daughter, who's brilliant, and she was working at Subway, and she felt like a little bit, I think, that she was disappointing me. And I'm like, you're not disappointing me. Be the best sandwich maker that you can be. If you're happy, I don't care what you do.
Absolutely.
But if you're not happy, I don't want you to be there. Like, I don't care. I literally do not care what you do in life. I just want you to be happy. So if you want to make sandwiches for the rest of your life, just be really good at it and enjoy it. Fortunately, she didn't want to do that. She wants to be a psychologist, but still, like, I think it's important. Like, so in the careers that I was at, I was very happy doing what I do. Like, I do behavior, autism, a bunch of things that I was really good at. But now I'm at the other side of my career. And, you know, you can only do that for so long, and it becomes draining because it pulls those kind of careers, like doctors a lot more, but they pull from you. They pull your empathetic nerve. They drain you after you've seen that much trauma, that much pain, and you have to segue. And Soaring Profits is one of those things. It's a passion of love for me. I love talking to people like you who are amazing and wonderful, literally changing the world. This whole idea of healing the whole person, I think, is beautiful. And I think more and more doctors should do it. I'm sure it's going to spread like wildfire, especially with people like you teaching it and talking about it. So you're at the virtual clinic, and like Pat was saying, a patient comes in. How do you treat them? Like, you have the DNA, like, you can't do an MRI, you can't do all these different things.
I can. Actually.
Yeah. Okay.
So yes. So even we are virtual. The first thing that I ask is the goal, right? Because my idea is they don't come to me as a primary care doctor. I am not here to replace their primary. I am here to complement what the primary will not be able to do in 15 minutes. That's the goal that I set for myself. I will be the bridge for that gap. The first thing is, what's your goal? What do you want to achieve with me? How can I help you? After I have that clear, we will elaborate a plan, right? That will consist on the test, of course, the standard test to know the baseline. But I add to that a couple of things. Number one, I check for all my patients depression, anxiety, resilience, burnout, well-being with a standardized test. Why? Because if I have someone very depressed, for example, or super anxious, or with very low resilience, I know that I will have a hard time if what they are trying to do is to reduce their weight. I need to fix the mental aspect before I put them in a diet. That will not fly. So for me, it's very important to know where I am. And the second thing is that it's also a good parameter to follow, right? If you start with a test, especially the well-being one, right? And they are in 3 points, 4 points, 3 points, and my maximum is a 10, I expect to go with these numbers to, I don't know if a 10, but a 7, a 5, you know, and improve. So are very good parameters that are not subjective really, and that go together with what the patient wants and the goals that they want. So that's number one. The second is, I will send the test. The test will depend on the needs and the situation of the patient. Majority of the tests, I try to send them directly to home. So the patient doesn't have to go to a laboratory. We have right now a lot of technology. So with a drop of blood or saliva or urine in your house, you put it on a FedEx and you send back. At the end of the story, a couple of weeks later, I receive the results. So it's very convenient. So people that are already stressed by life, they don't need to go to a laboratory. You don't need to stress them more, right? Let's keep it simple. The vitamins or any supplement will go directly to their house. They don't need to go to a pharmacy. So again, that simplify their process. If they are looking to lose weight or they are working in the well-being, the physical well-being, I normally send them on a scale, on a smart scale, and a fit device so I can monitor them remotely, and I can get track them through the phone or through the computer. They just connect me, and I can see the routines and follow that, right? And again, it's giving me data, so I can have a specific targets, nothing subjective. I am very science oriented, right? If I tell you you need to sleep 10 hours, 3 hours are not 10, right? So you know the goal, and you are part of it. I empower the patient to know these numbers, to know the goals, so they can achieve them with me. At the end, they are the ones that are doing the hard work, right? I am just the cheerleader and the coach. And I share all these results, all these parameters with the patient, and I teach them everything. I give them all the tools. It's like, this is what we are doing. This is a calculator. You can calculate your own this, and we will do this. And this is exercise. Okay, I will tell you exercise. If you clean your house for X amount of minutes, this is 4 minutes, and this is what we need to do. So don't need to go to the gym. So I give them realistic ways to fulfill the requirements, right, without this being traumatic. And of course, they receive also diets that are done by artificial intelligence based on all the characteristics. So they create, super cool diets, weekly basis that we can adapt, etc. So, and then they have the mindfulness coaching. Majority of them, at least, they have 3 mindfulness sessions where they learn how to manage stress, or if they are eating too much because of stress, how to eat mindfulness in a mindful way, so they, don't overeat. And it's really teamwork. It's a communication. They send me messages. I did this. I did that, and it's kind of funny to see results, right? And to know that they know their body. What I hear all the time, what makes me very happy, is that, oh my God, I didn't know. Nobody told me. And oh, it's as simple as that. Oh, and that's why. And I'm like, yeah, so cool, right? And to make this a journey that is feasible, that is achievable, and that is fun. Because at the end, if you don't like it, you will stop it.
I just wish that when I was going through it, I had a Dr. Z, because I went through all that. At first I lost the weight. I had to find a diet that worked best for me. I ended up with the keto diet, which worked amazing. After that, I was thin, and I was looking in the mirror, still hating myself. I still had depression. I was still suffering. And then I had to break that down. And if there was someone who could have coached me through that, I just felt really alone. The people around me didn't understand what was going on. In fact, a lot of them thought I was dying of cancer. That's what I got a lot. Is people would ask me, because I lost a lot of weight in a short, I think it was 3 months, I lost 50 pounds. I dropped so quickly. So I think what you're doing is amazing, but how, so I've helped other people go through what I've gone through, but I do it one-on-one, a couple at a time. You're talking about a whole group of people. How do you keep track of all that? I get that there's apps, and I get that there's AI and all that stuff, but how do you find time? How do you get 10 hours? Mrs. Z, Dr. Z.
I don't. I never. I have been, I had suffered from insomnia all my life. I don't say that I suffer. I enjoy insomnia all my life. So I have extra hours. The truth is that I am very good with documentation, and I believe that it goes beyond the fact that it's the correct thing to do, and a clinical visit is a legal visit, right? It's a document, a legal document, but it's very important for me to document the conversations very nicely and to explain the plan. And again, I share that document with my patients. They have access, so they can go back to the plan and see. They can use the calculators because they lose weight, so now they can calculate again the cardiovascular risk with the new weight and see, oh, I lost a few pounds of risk, right? Or a few points of risk. So again, for me, teamwork with your patient is the best way to get positive outcomes. And even if you will not get, because let's be realistic, there are cases where you will not have the outcomes that you want, right? Nothing is perfect in life, but when you are transparent with your patient, when you work with your patient, when they know what you are doing, you explain step by step what you are doing, right? And that there's a percentage of cases that, oh, maybe this thing will not work, but we will have plan B, plan C. It's easier for patients. And what you were saying about losing weight and still not feeling emotionally okay, obesity is truly a very complex disease. And I want to use the word disease because it's the correct word, right? It's a medical condition, it's a disease that is not only associated to mortality and cardiovascular risk and diabetes and many things, but sleep apnea, but also with mood disorders, right? And it's a very interesting cycle where mood disorders may cause obesity. Many medications that we take for mood disorders may cause obesity, but at the same time, obesity cause this depression, cause this isolation, this anxiety, disability, etc. And if you cure one part but you don't treat the other, you have this person that looks skinny, right? But they still have a broken heart. So you need to teach them how to fit in the new body. And that's very difficult. It's not only to buy new clothes, it's to learn how to be that new person. You watch yourself in the mirror and you are not your typical you are a different person. Who I am, how do I fit in this world, what do I do now, how do I act, how do I get new friends, how I am not judged. Again, very complex. And a majority of teams that will nicely work with obese patients and will help them, they will include some kind of counseling. It should be part of it. How tech savvy do patients have to be? I will say that if they know how to use a cell phone and or a computer and turn the camera, everything else is truly very easy. And for those that they don't know how to go inside of the website or and see their notes, I will email the notes to them. I will try to make it as simple as possible. Nothing complex. Very simple.
Well, that's perfect. Dr. Z, first of all, I want to thank you so much for joining us tonight on Soaring Profits Thursday Night Live. What you're doing is, we have really inspirational people that we talk to. We have people that have done all kinds of wild and crazy things. Some of them have, doctor in front of their name. Some of them do not. And you're jumping outside of that medical box and you're really looking at people not just as another name on your billing roll. And I appreciate that. And for myself, my parents who, are older people, as a caregiver, as someone who is dealing with these individuals, I all too often find myself in medical offices where it feels very static and it's stagnant and it's just, the white sheet and the white lab coat. And, someone like yourself with, just your story, who you are, coming from Peru where you find yourself now, and God bless Alex for keeping you. Right? What a guy. But that whole story is beautiful and it goes to who you are as a person. And I appreciate what you're doing. Now, from us, obviously, thank you so much. But I want to jump into something else that we're working on here. And James has put some graphics together. It looks like we have a mental health run that we've been working together with the Be Daring. I'm going to eventually get that at some point. But the Be Daring Foundation, and this is with the Walking Tall folks and Chris over there. We've got a bunch of stuff on the go right now. We've got the Be Daring. This is an opportunity for people to sign up. They're going to be doing a virtual 5K. Now, Dr. Z, I understand you've probably got some clients that might be interested in getting out there. If not yourself, make sure to maybe check it out. But our whole process here is really trying to work with the Be Daring Foundation. And this was a very sad story of 5 NCAA athletes that unfortunately succumbed to suicide. And what they've done is this is the 5 to Thrive run. And working in tandem of this is that they put this whole package together where we're looking to raise some money first and foremost, but like Walking Tall is to raise some awareness and break that stigma. And when you have, physicians and doctors like Dr. Z out there that are doing this holistic, the multidisciplinary approach to your medicine. It seems like we're all on the right track. And again, Dr. Z, I want to thank you so much.
Thank you.
We need to roll the video for 5 to Thrive.
Let me bring her up.
Who cares if one more light goes out in the sky of a million stars? It flickers, flickers. Who cares when someone's time runs out? If a moment is all we are, or quicker, quicker. Who cares if one more light goes out? Well, I do. The reminders pull the floor from your feet. In the kitchen, one more chair than you need. Oh.
Please do
I don't know,
help
but
if you can.
I don't know, but that guy's getting pretty good at the overlays.
I'm trying very hard to get this down. Yeah. Please do help. Jump in here. Let's get some people in this run. You can walk it, you can run it, you can roll it, whatever you want to do. Just scan that code, join in. Let's raise some money to help mental awareness. Five young, beautiful, had their life ahead of them people that I imagine all the people around them would tell you that they had it all. They were happy. They had everything. 5 of them killed themselves in 2022. Can you freaking imagine? 5 young people.
James,
That is ridiculous.
I'm sorry to interrupt you, James, but I just want to bring a little extra of awareness, right? Sadly, in the U.S., 46,000 of individuals died by suicide the last year. This year is already 49,000.
Wow.
So even more. So we are seeing more than 130 deaths per day in this country by suicide. 400 are physicians, 500 are kids between 6 and 10 years old, the ages of my kids. So this is really an epidemic, and what is important, and you just mentioned it, this is something that we can prevent. This is something that we can really do some, prevention. We can give support, and we can change if we get involved. So yeah, congratulations on everybody that is doing it, and I will join.
I love it. No, that's great. And again, Dr. Z, thank you so much for joining us tonight. It's beautiful what you're doing. And especially, even just that little segue that you pitched there, it shows that you have a passion for this and an advocacy for this. So from me, folks, we've got some unique things that we're working on around here. Like always, James, as you see, he's got these little snippets that he's been working on, and he's been doing a great job. First of all, James, thanks, man. This I can tell that you've put a little bit of work behind this, but we're actually looking to launch a new show as well. We're wanting everyone to like, subscribe, and share. And what this next show is sort of a high-level finance piece. And those of you that have been following this for a while, you know that finance is my wheelhouse, and it's a bit of my passion. And James is I don't know, you've basically held a gun to my head. But, other than that, it's been a process. But
I told you you're doing it.
That's what it was. I was voluntold is what it is. But I'm actually super excited about it because I'm a nerd when it comes to this sort of thing. And what we're looking to do is we're looking to look at finance. We're looking to interview high-level individuals, and we're looking to talk at that next level. So, Dr. Z, for instance, you specialize in medicine. It would be like you having a bunch of physicians around the dinner table. That conversation gets a little bit higher, than what you might generically talk with, your friends and family. And that's what we're hoping to do with this new show. And because it's James, we have a clip. Hang on. So
I just want to give a special thank you to Sia. All of those clips where you saw live action, where we were in Texas, San Antonio, Texas, she was in charge of that. She is a beautiful, beautiful young producer, wonderful lady, and dear friend of mine now. And we have learned a lot on Soaring Profits from her. And I just want to say thank you. I drew a lot of her work into our clip. I can't wait to see what we're going to build here. We got some great guests coming up. Sorry, Pat, I just wanted to throw in that Sia, thank you so much.
no, that's great. And I appreciate that, pal. So again, we're a little over that hour mark. Dr. Z, thank you so much for coming. How do people get in touch with you? What is some of your handles? What do you have? Where can they find you? I know we stumbled across you on LinkedIn. We've been in love ever since. Short of Alex, we're very respectful of Alex.
Yeah.
He's a great
Sorry,
guy.
Alex.
Yeah, sorry, bud. But how do people get in touch with you?
So LinkedIn is a very good way to get in touch with me. I appear as Dr. C. My email is drc@virtualwellbeingmd.com. My website, virtualwellbeingmd.com. And I'm here.
I love it. That's fantastic. Well, from me, folks, Dr. Z, I love what you're doing. From me, let's make some money together, guys. James.
And here I am. So I just want to say, I always give a shout out to these guys, Walking Tall. They're all about mental health. They're out there, walking the walk, talking the talk. They are out in the community all the time trying to raise people together. And their whole message is together we're stronger. And I think that is a beautiful message. I love it. At the moment, I don't see a Be Daring one, but Be Daring, another great organization. Check them out. Michelle is doing so much. She is like headlining this 5 to Thrive because those 5 young athletes died, and it really touched her, and she wants to promote mental health and all the things we can do. Please check us out. Please sign up to our team. This is specifically our team. Not only do you raise money for Be Daring, I believe Walking Tall, but also an organization close to home for us. And we'd love to see that. And if you get a chance, just for fun, buy a Toasty. Great pillow. Love it. It's wonderful. She's a wonderful person. All these people are great.
Yeah.
Dr. Z, I absolutely love what you're doing. I wish we had more people like you in Canada that see the whole person, because it wasn't until I started, checking my food, checking my diet, exercise, mental health, and seeing myself as a whole person. I had to discover that by myself, and that took a lot of learning and a lot of determination that not everyone has. And if you're out there and you're struggling, first of all, you can do it. I am not special. I did nothing different than I just took one step at a time. I picked something. I did it every day. Once you start something, it becomes habit. Once it becomes habit, it becomes your routine. And once it's your routine, you can do anything. Instead of saying, I want to lose weight, say, I'm going to walk every day. That's your routine. It has nothing to do with losing weight. It doesn't matter about the weight. And it matters about moving, getting out there, doing things, joining groups, because in isolation, that's when your mind attacks you. Get out there, get in a group, whatever it is, go throw an axe. It doesn't matter. Get in a group, and let's raise everyone up, like Walking Tall always says. Thank you, Dr. Z, for coming on the show. I just love you to death. Alex, you picked well, man. You picked well, and I'm glad you brought her to America. Now, if you could bring her to Canada, if you get a chance, Alex, just say, hey, man, we're going to Canada, and we'll set you up here. I love you all. Profiteers out there, let's heal our minds, bodies, and souls.
Now, Dr. Z,
it's
this is where we leave you with the last word. So as we sign off here tonight, words of inspiration, words of wisdom, what are you sending off for the profiteers this evening?
I will use a phrase that my kid told me a couple of years ago. He was 7 years old at that point, and he changed my life. He told me, this is your life, this is your choice, this is your journey. Wow. And I believe that that's the best thing I can recommend anyone else. Like, embrace life, do your best, and, learn, enjoy it, we are here for one period. Let's make it, to be worth it. Don't be a victim. Be the owner of your life.
I love it.
Love that.